This evening, Rosie and I will be giving you a practical approach to pain management in endometriosis. I'm going to explain endometriosis pain and the non-drug treatments for including pelvic physiotherapy for painful sex. I will offer a wide range of pain management tools and strategies for dealing with endo pain, abdominal bloating, and fatigue. Next slide. Next slide, Pat. Let me first acknowledge that having endometriosis can feel really scary and overwhelming at times. I'm sure many of these that will come up on the screen in a moment will be only too familiar. Pain is the major hallmark of endometriosis. And pain symptoms include painful sex, pain during periods, pain not related to periods, bladder pain syndrome, painful bowel movements, painful urination, abdominal cramps and bloating. There are many psychological and social aspects. Often there's fear, guilt, self-blame, grief, loss, perhaps loss of the future you thought you were going to have. Endometriosis often makes women feel a little bit broken. And I think this really does contribute to the hopelessness that some women or people assigned female at birth can feel. Trauma is definitely a part of endometriosis, and I'm sure you can relate to the experience of, because endo has no cure, and sometimes there's a very long delay for wait for diagnosis, and maybe you've been a bit gaslit or your symptoms have been dismissed. There's also an element of distress for parents and partners and loved ones of those with endometriosis. And when I talk about trauma, what I mean is that it very much is the experience of having an unprecedented experience that overwhelms your ability to cope. Next slide, please. So we'll move on to endo pain. Pain is highly subjective and it's unique. Pain is defined as an actual or potential tissue damage, and it's the experience. Endo pain is described as sharp, shooting, dull, deep, fierce, twisting, pulling, tugging, crippling. Some women experience endo pain mostly in their abdomen, some in their lower back, whilst for others, it's mainly ovulatory pain or pain in the inner thighs, pain shooting down the front or the back of their legs. And very much the nature of endo pain is variable. For some, it's constant. For some, it's predictable, random. And some have endo pain all the time, but have flares of intensity. And of course, there's pain during or after sex. 2/3 of women will experience painful sex. There'll be more on painful sex later. So understanding pain is absolutely fundamental in order to manage it, to tame the beast. Just by learning about pain, you can actually turn down the volume and control it. Pain is a really important alarm, but it does not always accurately reflect tissue damage. The nervous system is exceptionally plastic. It learns pain, and therefore, pain becomes more easier to produce. The pain messages get mixed up, becoming exaggerated, amplified, and out of proportion. Endo pain results from an overprotective, upregulated nervous system. Endo pain can become exaggerated by peripheral, central, and cross-sensitization. So you're stuck in flight, fright, or freeze mode with the alarm constantly going off. All the current research is indicating that by learning about pain, 1 in 4 patients by learning the pain science, you can have a decrease in your pain symptoms by 50%. That's great news. So just by learning about pain, it actually alters your nerve sensitivity and your brain chemistry. So understanding pain is really crucial, and it explains why a woman with stage 1 superficial disease can have more severe pain than someone with stage 4 deep infiltrating frozen pelvis. Endoinflammation and scar tissue, adhesion formation, results in surrounding muscles having reduced mobility, blood circulation and lymph flow. Endochronic pain results in a sensitized, upregulated nervous system. And it very much is a kind of hypersensitivity to pain. I'll now hand over to Rosie.
There you go, Rosie. You're muted, Rosie.
Oh, thank you very much. Thank you very much, Pauline-Clare. Good evening, everyone. I'm Rosie McCloskey. I'm the endometriosis specialist nurse for the West of Scotland, and I'm based at the Queen Elizabeth Hospital in Glasgow. So thank you to Pauline-Clare for the lovely introduction, for the excellent information of what endo pain is. So for the purpose of the presentation, I'll be referring to women as female assigned at birth. Endometriosis is a long-term condition for which sadly there is no definitive cure. Symptoms can affect the full body and has been deemed part of the autoimmune disorder. To put into context what challenges women with endometriosis have on a daily basis, I thought I would start with sharing a slide from an interactive patient awareness session I did recently for the Endometriosis UK. We looked at 3 things that the patient or their partner, friend, parent that was present at the event would associate with endometriosis. It is important to look at this as a patient and their close ones have lived experience with this chronic condition and have validate the challenges the woman experiences with regards to symptom management such as chronic pain and the effect this can have on the whole body. As you can see from the slide, that the pain is very high on the day-to-day symptom that affects on women. From the next slide, you'll see that the possible impact on the body's function and the different type of pain a woman may experience. We have reproductive pain that can involve ovulation pain, pelvic pain, cyclical pain. There can be chest symptoms with diaphragmatic disease, shoulder tip pain. We have the effects on the bowels with altered bowel motions. We have constipation, we have loose stools, and it can be excruciating when the bowel moves. There's a urinary symptoms such as a feeling of a UTI when voiding urine or back pain, but with all the urinalysis tests are negative. Now, this can be really distressing for women because they feel like it's all in their head. We have pain during and after sex, and this pain can last for days afterwards. These symptoms can not only change from day to day, but minute to minute. For many years, some women have been told it's just a bad period, take some paracetamol. Every woman bleeds, and a woman's heavy bleeding with large blood clots the size of the palm of their hand is not normal. But how can we compare our bleeding pattern to others? It's unique to each woman. Hence why it takes so long for women to know that this is not all right to experience these symptoms. But once there's discussions with friends or reading some educational literature, they then start to embark on multiple visits to GP and gynaecology service to explore. These symptoms can have a significant impact on a woman's quality of life and everyday function, with negative impacts on their interpersonal relationships, start retracting from social events and gatherings, and then in turn brings loneliness. They also feel they don't have any energy, they've got severe fatigue, and this has an effect on their being able to function as well as with unpaid employment. This is then providing for their family, so this brings emotional distress from that and a detrimental effect on the financial implications. The consequences on a woman's mental and physical health can result in stress and worry and a feeling of hopelessness with no way out. So let's start looking at why some women experience symptoms including pain more than others. Importantly, pain is what the patient says it is. They are living with the pain day to day. Patients feel that validation may come from the surgical stage of the disease, And this is the questions that patients largely wish to know. What stage is their disease? Is the surgical staging 1, 2, 3, 4? However, research has shown that staging does not always depict the symptoms a woman's experiencing, and that all symptoms are relevant and they should be respected and validated. What matters is how it's managed, how it's supported, and how it's listened to, recognising the patient's needs, their expectations, and very importantly, as I said before, validation of the symptoms and the distress they're experiencing. One of the conditions that's talked about very often and very misunderstood is adenomyosis and the symptoms that this can bring. Often a skilled gynae surgeon or radiologist can identify this and the patient is advised of the reasons for their symptoms, but this is not always the case. Adenomyosis is when endometrial-like tissue grows into the muscular layer of the uterus, the womb. The symptoms are similar to endometriosis, with a diagnosis with primarily presentation of heavy bleeding. The evidence has shown that the symptoms include horrendous knife-like pain into the vagina or the womb, back pain, changes to their bladder function. Adenomyosis can be managed potentially by progesterone pill or a Mirena coil, but it cannot be surgically removed at conservative surgery. And so the only definitive management in regard to surgical intervention is a removal of the womb itself. So if a woman is trying to preserve her fertility, if this is her preference, or they do not wish to proceed with a hysterectomy, then management can be to try and support with medicines or analgesic pain. So for pain management of women with endometriosis, it's paramount with a full holistic assessment on the effect of the women's quality of life and their psychological well-being. Supporting self-care symptoms. For women with endometriosis-related pain, it's very important to explore the benefits and the risks of hormonal therapy and analgesics, taking into account any comorbidities and the woman's preference, as discussed before, including fertility desire. Medical managements include analgesia and hormonal therapies. The needs and preferences of the women should always be considered. This will include their wishes for future fertility, experience of previous treatments that they're just really not wanting to do that again, try those things again, their comorbidities and any potential contraindications to treatments that they've had previously. So in this next slide, we see what are the options of approaching symptom management. Well, obviously, one of the options is the surgical input, as I've discussed before. However, the natural history of endometriosis is to reoccur through time. From a surgical excision of disease recurrence is about 20% in 2 years and about 50% in 5 years. A hysterectomy is not always a cure that patients believe it will be, with the exception of patients with confirmed adenomyosis, as discussed before. So the alternative to surgical includes conservative medicine management. Medications are used to attempt to alleviate the symptoms of endometriosis. However, symptoms can return when the medication is stopped, as they do not cure the disease. Considerations of what the patient's symptom is most important, of what's most severe to them, and that is their starting point there. So the medicine management includes analgesia, say pain relief, and hormonal therapies. The needs and preference of the woman should, as I said before, always be considered. If the pain is most a symptom, hence the reason for the webinar tonight, but the bleeding is still a struggle, then tranexamic acid can reduce menstrual blood loss, but does not affect the underlying cause of the dysfunctional vaginal bleeding. Tranexamic acid is a non-hormonal option that reduces menstrual blood loss and improves the quality of life of patients with heavy menstrual bleeding, and so it's an option with hormonal treatments are not desired or recommended. So treatments discussed to offer regards to pain and bleeding, obviously let's start with hormonal therapy. Hormonal therapy works by suppressing ovarian function and typically contraceptive in nature. These include the contraceptive pill, the intrauterine device such as the Mirena coil, the contraceptive hormone injection such as Depo-Provera or the other name, Ciana Press, and Nexplanon. The first most acceptable beginning of trying hormonal therapy would always be the progesterone-only pill, such as desogestrel pill. This is 1 tablet a day, and so it's easy to stop if there's unwanted side effects. Danagest is one of our new kids on the block. It's a norethisterone derivative that's got a prostagenic effect on the uterus, the womb. It works by reducing the production of the estradiol, thereby suppressing the endometriotic lesions. We've had really good results of this drug in relation to support around pain and bleeding management at the centre. The next one would be what you probably call medical menopause or chemical menopause. It's a gonadotrophic releasing hormone, also known as a GnRH analogue injection, which is used for the management of endometriosis. We use this, as I say, as a medical menopause with add-back HRT, such as Tibolone or the patch, Everil Conti. Initially, the first injection would be 1 monthly, and if it's tolerated, we then potentially move on to 3 monthly injections. However, this is not an indefinite treatment and does require an end date, so it's not something that can be taken indefinitely. For those patients not wishing to return for injection provision, but instead wish the flexibility of oral management, there's a new medication, not yet licensed for endometriosis, but it is pending. Reeco is a non-peptide gonadotropic releasing hormone receptor antagonist that prevents follicular growth and development, thereby reducing production of estrogen and progesterone. The add-back HRT is also in the combined tablet, and it does have some estrogen to reduce the symptoms related to medical menopause, such as hot flushes, sweats, brain fog, and it has a progesterone norethistron to protect the lining of the womb. Currently, it's only licensed for fibroids, but it should be very soon when it will be available for prescribing for endometriosis, and in some cases we are prescribing that just now as an off-licence medication. From a neuromodulator point of view, research has shown that duloxetine tablet is the most effective for pelvic nerve pain. Women describe the pain that is spreading down the front or the back of their legs. So how does duloxetine work? Duloxetine works by increasing the amount of specific nerve transmitter in the nervous system, reducing pain messages arriving in the brain. It's especially good for nerve pain such as burning, shooting, stabbing, and the pain that keeps you awake at night. If the pain is a constant dragging endometriosis pain, then it's best to take regular pain following discussion with your endometriosis nurse or GP to try and control the daily pain and not dipping it in and out of pain relief when it's at its utmost highest. And as many women will experience, it's very difficult to come down from the crescendo of pain. We also have, which is very good, lidocaine patches, and it's a local adhesive plaster for localised persistent pain. So sometimes like ovarian pain, people say, you know, I really feel as if it's at my ovary and if I could just get to it. So it's mainly used for relief of neuropathic nerve pain. The lidocaine patch just looks like a plaster, as I say. It's a local anaesthetic. And local anaesthetics work by stopping pain signals from reaching the brain. And you may feel some pain relief on the first application, but can also take 2 to 4 weeks of using the patch every day before you notice the pain. So it's 12 hours the patch is on, 12 hours the patch is off. So it's working around when's best for you. Is it during the day when you've got work and you're trying to manage, or is it the pain is worse, it's night time, so your 12 hours would be from an overnight point of view. So women find a good source of heat is what their go-to is, and they find that they've got many different hot water bottles and different colours and shapes, and that is their source of support. Also, much research has been done on diet, maybe an important aspect with endometriosis and the inflammatory effect, and so potential of management of pain, it can be supportive. Food for thought would be to eliminate certain foods to ascertain if they are helping, such as cutting out fried food, processed food, white flour, pasta, definitely, rices, and instead opt for foods rich in omega, such as oily fish, whole grains, walnuts, and blueberries. Living with the chronic pain is incredibly difficult, and the experience of constant repeated episodes of pain is unique to the woman and is likely to have a big impact on how the woman feels and thinks. In view of this, mindfulness practices and cognitive behaviour therapy can be successfully used to support around managing the frustration and exploring the challenges endometriosis has on a woman's quality of life. Next slide. So how does endometriosis affect a patient's quality of life? So day-to-day employment issues. Not all women have a job. They can leave the desk or leave their role for frequent toilet visits to change a pad or take pain relief. Some women find that perhaps taking pain relief means they're not able to function appropriately at work. Not being able to have access to a hot water bottle at work, if this is their source, if they're not able to take any hormonal or analgesics. Many women find that they've got a caring role, they're looking after others, whether it's a relative or raising or managing children, and the stress this brings and the worry, especially when a woman feels she can hardly look after herself. These stresses have an impact especially on the women, but also family, friends, and relationships. They also find hard managing their own expectations from themselves and from others. And if the woman does have children, there's lots of research around mother's guilt, missing out on activities and events. This is also the effect endometriosis can have on fertility and the journey that a woman may embark on, but also from a sexual activity, which may be too painful to even try for conception. Fertility may not be a patient's concern, but miss the intimacy of sexual contact with their partner, which is impossible due to the pain. These challenges can affect the mental health and leaving some women feeling hopeless and despondent. Next slide, please. So we can see the effect pain has not only on the physical symptoms, but it's also important to remember the mental health and well-being. Research has shown that chronic pain increases depression and anxiety. This can be due to the build-up of years of chronic pain, not believed and gaslighted, desire to feel themselves again and doing mundane things like tidying the house, doing their own shopping instead of relying on others, able to do activities that you would deem as part of your routine of life, which just does not feel possible. Potential fertility outcomes, not being able to have a pregnancy either naturally or IVF due to endometriosis. Even if a family is complete or they're not wishing to have any children, the thought of embarking on a hysterectomy, perhaps due to adenomyosis, is a closure of a chapter, and it's very, very personal, but it can bring loneliness in their own thoughts. So this is where drugs, as we discussed before, like diloxin, can be effective for nerve pain, but also as an antidepressant and can aid some mental health concerns. Patients express that with use of diloxin, they have more clarity. So whether it's clarity because they don't have the same nerve pain, or is it because of the kind of almost like the side effect of the diloxin can be an antidepressant. Importantly, it's to ensure that the woman is pacing themselves, setting realistic goals. The goal shouldn't be about making someone else happy. It should be about something that benefits you, something that makes you feel good about yourself. Using pacing techniques with realistic goals would be hopefully ensure that there's no flare follow-up. So thinking, for example, going for a 30-minute walk on alternate days, going swimming once a week, doing pelvic stretches, things that are achievable goals. Next slide, please. So we've looked at the symptoms, including psychological effect, can bring higher levels of anxiety and depression and on affective mental health. These are challenges and desire of wanting to improve their own quality of life by using medicine management and work on prevention disease progression, while also taking into account that medicine for this may result in the impact of preventing a pregnancy. Important to look at coping strategies. This may be through endometriosis support groups. Other people with endometriosis can support with similar lived experience, and this includes ways of employer support, as often women can be passed over for promotion and career progression due to sick leave. As mentioned, this is what's missing from endometriosis care, is psychological support. The woman is already managing frustration, gaslighted within clinical medical world, and the misconception of just a bad period. And I do believe the requirements is we desperately need psychological services and support for women. Next slide, please. Living with chronic pain and symptoms can be overwhelming on a day-to-day basis. As we looked at before, there's a huge impact, the overwhelming guilt of cancelling events, missing events, because there's just no energy and this true fatigue that cannot be expressed. Exploring myths that it's not just tiredness, it's the chronic fatigue where you just feel you cannot put one foot in front of the other and not being able to function. Feeling like they can't cope, this brings stress and emotional upset. But self-care is so important, and taking rest days and not just keep pushing on. Making time for yourself to relax, have a hot bath, pelvic stretches as discussed, mindfulness either by listening to music or doing something that makes you smile. It could be anything from playing a game on your iPad or focusing on a conversation with a friend, getting lost in a book. Mindfulness is an effective practice for approaching chronic pain. It teaches us to observe the pain and be curious about it, as Pauline-Clare had said. And while it's counterintuitive, it's this very act of paying attention that can help your pain. Okay, last slide, please. Most importantly, it's about listening to your body, being kind to yourself, and that self-care is so important, and taking rest days, and not pushing on. I hope by listening to this, you can appreciate the challenge a woman with endometriosis has to manage on a daily basis, and how strong these women are, and that they're living with this chronic pain, and these symptoms can be overwhelming. Women with endometriosis do not need other people's validation or acceptance. You are enough to those that are around you and that love you. And it's most important to know that you're not alone. talk to friends and family who have a supportive ear. Thank you very much for listening.
Thank you, Rosie. You will forgive me because I'm going to speed up because we've still got a lot of slides to go. Okay, so 2/3 of women with endo experience sexual pain. So you are not alone. And whilst it is common, it is not inevitable. Women are given many unhelpful pieces of advice, like try wine, try some more wine. Just try and relax. There's plenty of other things you can do. If you loved your partner, it wouldn't hurt so much. Do you want me to refer you to a sexual counsellor? Just push through it, or push through it, as we would say in Glasgow. But if you desire penetrative intercourse, then, or you're trying to conceive, then that's not helpful advice. The experience of sexual pain lowers your sex drive, leads to poor arousal and lubrication. Vaginal dryness does contribute to pain. For women who are dealing with sexual pain, sometimes they're just barely tolerating it. And for others, avoidance is their strategy. And that can put additional strain on relationships. However, support is available and it is possible to resurrect your sex life, even if it's been years, months, or just days. Next slide, please. So pain with sex can be both superficial and deep, or it can be a combination of both. So vaginismus is an entirely involuntary spasm of the pelvic floor muscles, which makes penetration impossible. Tampons won't go in, they get stuck. It's impossible to do a speculum examination. And nothing, not a finger, a penis, a dildo, a sex toy, nothing is getting in there, and it's very painful. For vaginismus, physios will work on helping you locate, relax, and lengthen these muscles. We do external and internal work. And we'll give you a set of dilators to work on your own home program. And we also use pelvic wands like this one. So this is a vibrating one. It's not a vibrator per se. So it has a vaginal end and a rectal end. And this actually does the work that we would be doing internally so that you can do it yourselves. Very empowering. So we give you a set of dilators, or you can buy your own ones on the internet. And physios advise on sexual positions, so it's usually a no-go for the missionary position. We would encourage it if you have deeper pain or dyspareunia, that kind of burning pain that can last for days or hours. Again, we'll do some internal work and teach you how to do a vulvar massage and the use of penetration devices such as the O-nut. So these are barriers that you just cannot go deeper penetration with the use of some of these penetration barriers. I've left you my top tips here. So it's really important to work on good arousal, extend foreplay. Use of lubricants can be throughout a woman's lifetime. And I would like to see women get physio who have sexual pain, particularly in endometriosis, because it can be very effective. Next slide, please, Pat. Abdominal distension or bloating can be highly distressing. So bloating is that subjective sensation of abdominal inflation, and the distension is that objective, measurable increase in girth. The so-called endo belly takes a real big hit to women's self-confidence, body issue, and self-esteem. The common phrase that Rosie and I hear is that I feel like I look 6 months pregnant. And if you are having issues with fertility, it's not helpful. Women say they don't recognise their bodies or even require a different wardrobe. I'm going to give you some tips for bloating. So there are multiple causes for bloating, and it's really important to treat constipation, because the way we get rid of excess estrogen is through our bowel movements, through our feces. So it's important to treat constipation. And abdominal self-massage can also be very helpful. Next slide, Pat. So fatigue management. Fatigue is very common. Stress, anxiety, and depression can all contribute. Stress, anxiety, depression, and insomnia can all contribute. So it's a two-way relationship with pain. Pain makes your sleep disturbed, and sleep or lack of sleep can also make your pain worse. So it's a kind of vicious cycle. You also have an immune system activation, chronic higher fatigue, and it just becomes this kind of downward spiral. So the proven solution is to become more active. So do try to, when you next feel really exhausted, try to be more physically active. So even though you're tired, do become more physically active. So put on your favourite 80s tune and have a dance, or have a walk in outdoor green space. You need to take it up a level. We're all much more sedentary than we should be. We spend much more time on our phones, scrolling our phones, or sitting driving in our car than actually walking. So fatigue management there's an easy solution. Just to be more active. It is proven. Next slide, please. So managing flare-ups. Flares are one of the things that Rosie and I are asked about an awful lot. So it's important to anticipate your flares to be able to manage them. Identify what has worked for you in the past. And we use a lot of application of localized heat. So hot packs, hot water bottles, hot baths, gentle abdominal massage, pelvic stretches, the use of TENS, and supplement these treatments with mindfulness and distraction, because they really do work. The truth about progress is that progress, it's never linear. You will have setbacks and it can be spiky with flares, but as long as it's going in that upward direction. Next slide, please. Lifestyle management. Lifestyle management addresses excessive, it's really important to address your excessive stress. Stress reduction is well researched and long established as a core part of pain management. I'm aware that BMI can be a sensitive issue, especially regarding access to surgery and fertility treatments. And I'm mindful that some drugs can increase promote weight gain. But it's really important to try to maintain a healthy BMI range. Remember that 1 gram of fat equals 3,500 calories. So you need to achieve a calorie deficit. Balance your calorific intake with energy expenditure. Don't place unrealistic expectations on yourself. Aim for a slow, steady weight loss of 1 to 2 pounds a week. And very much beware of the snake oil. If you're not familiar with that term, that refers to a pseudo medical treatment or scam, kind of absolute worthless remedy. And let me be crystal clear that a lot of these snake oils are dangerous. They're nonsense. There are no supplements that cure endo. Vaginal douching or yoni steaming has no scientific backing. They're dangerous nonsense. They can disrupt the vaginal biome and cause burns, allergic reactions, and infections. There's lots of myths and misinformation about endometriosis. Please do use the chat function if you need any clarification on any snake oils or myths. Next slide. Abdominal massage is a powerful, a lovely healing self-care. It's very effective for treating painful periods, bloating and constipation, as well as excess gas. It's easy to learn and it's very calming to your nervous system. It follows the natural anatomy, so it goes from right to left, the ascending, transverse and descending. So it follows the course of your large intestine or bowel, and it encourages that kind of peristalsis, and it can be really, really calming. It usually is combined with abdominal breathing and relaxation exercises. Physios will teach you how to do it. The technique incorporates gentle effleurage, skin rolling, and vibrations. There's no sharp elbows, thumbs, or pokey fingers required. Usually performed in lying with the head and back of the knees supported to relax the abdominal muscles. You don't need to use any fancy oils or waxes, just a little lotion to prevent friction. And abdominal massage also really helps you desensitize scars, surgery scars. Acupuncture, the insertion of fine needles into the skin at specific points, and it may relieve endo pain. Next slide. TENS, transcutaneous electrical nerve stimulation, so a cross-skin nerve stimulation. A little portable box with electrodes attached, and it produces a kind of pins and needles tingly sensation. It's safe, it's effective, and there's no side effects. It works by blocking the pain messages and releases endorphins, the body's natural painkillers. Relatively cheap to buy. You can get them in most pharmacies and online. And there's been a lot of recent advertising and marketing to a brand, a portable brand, and it's not worth it. It's no better than your standard £20 device, and it really the portable ones, wireless ones, do not go well on a larger abdomen. So important thing about TENS is that it needs turned up after about 10 to 15 minutes because we have tissue accommodation. Your body or brain gets used to the stimulation, so you just need to increase the amplitude a little. If you're on high levels of opiates, which many women with endometriosis are, you need to use a lower frequency. Pelvic physios will help you with the correct setting, or I'll post it in the chat. But neuromodulation can also be used for bladder calming. So we'll tell you the best place to put the electrodes. So there's no need to buy a really expensive one. It's no more effective. Next slide. Pelvic stretch is really easy. I've put my two favourite pelvic stretches. These just to help to relax and offload the pelvic floor. Next slide. Exercise, for me, it's non-negotiable. The benefits of exercise are enormous, and we really just need to take it up a level. Choose an exercise you enjoy and try to sustain it. If you're not physically active, start slow, but definitely try to do something every day. Avoid the boom and bust, as we say, so that you do too much too soon and then abandon it altogether. On days when you're not feeling well, do less, but do something. Next slide. Sleep can be your superpower. Sleep is so important for so many bodily functions. Practice sleep hygiene. So sleep in a dark, comfortable room, which is well ventilated. Try to keep regular hours of getting up and going to bed. Avoid screen time directly before bed, and use your sleep. And if you can't sleep, seek advice. Very briefly, pelvic physios work on your pelvic floor muscles. Pelvic floor muscles are highly emotional muscles with a really strong muscle memory. Most people with endometriosis will have shortened, tight, overactive pelvic floor muscles. These can also be weak. So Tight does not mean strong. Muscles need to go through their full range of movement. They need to be able to contract and relax and lengthen. And this visual over here demonstrates cross organ sensitization or conversions. So it's the same nerves that are supplying your bladder, your bowel, and your womb or your uterus. So if one is unhappy, they're all going to be unhappy because they compete with each other. Next slide. Moving on to the endo-related pelvic floor issues. There are many, and I'm sure you recognise some of these, and physio can be really, really helpful. So there are many types of endo-related pelvic floor problems. They're all very amenable and responsive to pelvic physio. Pelvic physios treat all bladder and bowel symptoms as well as sexual pain. Next slide. There's lots and lots of endo myths, and very briefly, endo pain is not always progressive. It doesn't always worsen. Pain does not correlate to extent or stage of disease. Bladder issues are not necessarily bladder endo, and similarly, bowel issues are not necessarily bowel endo. It's often a big fear when you have bowel issues. You're worried that you must have bowel endometriosis, but it's a definite separate entity. Endo UK has a lovely information sheet about it, a fact sheet. Leg and hip pain is not always pudendroneuralgia, and if it is pudendroneuralgia, a physio can help. Endo pain can be treated in many practical ways, but all the drivers of pain need to be addressed. Next slide. So, reoccurrence of endo pain and endometriosis is not always, it's a big fear of people. So if I explain, you can have gold standard excision surgery by an excision specialist and you have reoccurrence of pain. And it's not that any disease was missed or that the endometriosis has returned very quickly after surgery. Sometimes if you have not addressed the chronic pain and you haven't addressed your pelvic floor dysfunction, that can be the driver of the return of pain. So it's imperative, I think, to have pelvic physio after excision if pain continues. Next slide. So this, I don't take credit for this infographic. This was presented at the World Congress on endometriosis in Edinburgh last year, and it kind of shows how much the research has grown exponentially. So we know that we have an evidence-based approach for the way we carry out physio in endometriosis. So it has a pelvic floor focus and a pain management focus, addressing all the other issues. Next slide. So in summary, physio aims to decrease endometriosis pain by balancing our tissue treatments, our localized treatments, with addressing that sensitized nervous system. So I'm leaving you with my top tips for managing endo pain. Self-compassion, self-care, self-management, and emotional regulation are all linked. Use lifestyle and fatigue management and challenge negative self-talk. Negativity breeds negativity. If you feel your pain is out of control, know that your reality can change. And if it is out of control, seek a second opinion. Get referral to an NHS pain clinic. Try to track your symptoms so that you're identifying flares, and reach out and get emotional support. So there's web chats and helplines available from Endo UK. Understanding pain is fundamental. Reconnect with your body in a novel and positive way. So find some joy. Challenge yourself to do something different, like cold water swimming for the brave. Next slide, please. So in summary, when we think about endo pain management, think of it as a toolkit. You have all different areas that are coming together. So lots of different tools and strategies that you can use to manage your pain. So you've got to address you've got to understand pain and have lifestyle and fatigue management, self-management strategies, and physical activity and social support. Next slide, Pat. So in summary, this has been an absolute whistle-stop tour of practical pain management in endometriosis. There are many practical ways to manage endo pain. I have highlighted some of the different options available, but they really do need to be individualised and tailored to your unique needs. Addressing lifestyle factors improves pain and quality of life. Physio is very beneficial, and the overall goal is to decrease the inflammatory load and to address your hypersensitised nervous system. So, what works for endo pain in a nutshell? Next slide. What works for endo pain in a nutshell? Movement. Get your brain to focus and pay attention on something other than that pain input. So doing pelvic tilts, gentle stretches, massage, physical activity all helps. Thank you.